Namaste viewers, welcome to our discussion today. And today for our discussion we have with us Dr. Revathi Ramaswamy. She is a senior consultant gynecologist and obstetrician at Apollo Hospital, Secunderabad. Ma'am, welcome to our discussion. And so viewers, I know many of you women might be having many concerns related to menopause. When does it happen? Why does it happen? What are the side effects? How do we cope up with this menopause? What are the later on conditions and what are the treatment options available for menopause? So let us all discuss all of these queries in today's session and hope all your queries will be solved. If not, our experts are there to solve all your queries. On one click you can book their appointments and then take their concerns. Thank you so much ma'am for joining us today, and so let's start our session with the first question. So as our topic itself says, menopause. So what is menopause?
Thank you so much, Harita. In today's discussion, I wish that we reach across a lot of women who are experiencing these problems or the so-called problems of menopause. What is menopause? It is after all a transition in a woman's life. It is something like, the hormone estrogen and progesterone and a little bit of androgens. They occupy and affect every cell of the human body, believe it or not, right from the cells of the hair right to the cells of the soul. So all of a sudden, when the body is not having these hormones, how does it react? It reacts like an alcoholic who is suddenly without alcohol, a drug addict without drugs. I mean, these are very wrong similes I am giving you, but for want of other expressions, menopause is a time when a woman is without her hormones. Those hormones which make her feel special, which make her feel like a woman, which give her so many health benefits as a woman. So that is what I call as menopause. It is a phase of life where a woman has to slowly be without her hormones. She has to accept a new phase of life, and not only accept, she has to overcome that phase of life. Is menopause an illness? Is menopause a sickness? Certainly not. See, as you know, we are humans, we are living beings, and we come with an expiry. We have a shelf life. And we have finished the young, we have finished reproductive, and now we have come to another phase of life. So let us learn a little more about this.
Ma'am, when does this menopause occur? In what age does it occur in women?
Yeah. Is there a specific age for menopause? Yes, but there is a range, starting from 40 to 55 is the range when the menopause happening is natural. It is a natural menopause between 40 and 55. Average Indian age is around 46 years. And why does it happen? Because when a girl is born, she has a limited number of eggs in the ovary. When she attains menarche, that is around maybe 10, 12 or 13 years, the numbers are kind of limited, a few lakhs, maybe 3 lakhs. She starts losing, every month she starts losing eggs. And supposing you have a skin injury, the skin grows over it. You break your bones, the bone grows and it reunites. But if a small portion of the ovary is taken out, new eggs cannot form. You are born with limited number of eggs. And there comes a time when the eggs are all done. There are no more eggs in the ovary. And that is when you attain menopause.
Ma'am, can this menopause occur early or can it be also delayed?
It's very true. If menopause occurs below the age of 40, it is called as premature menopause. And that actually needs a lot of supplementation and treatment for women. We need to find out why it has happened, because it can have delayed health issues for women. And if it occurs after 55, it is called as a late menopause. That again can lead to issues, and we need to be a little cautious, and we need to keep investigating to find out if there are problems or not. Both can be handled, but we need to know that it is not the normal scenario of things.
So ma'am, as we know that menopause is this change of phase of life of a woman, so there might be many changes in her body which can be seen, which can be felt, which are even underlying, etc. Many such things happen, whether it is early menopause or a delay menopause. So could you please elaborate a bit and tell us about that?
Yeah, so definitely there are changes in these transitions. Sometimes it is a very smooth transition, sometimes it is a very stormy transition, and every change is because the body is accepting the lack or the loss of the hormones, of the estrogens, play such an important role in the human body. So at this phase, there are some changes which are seen, there are some changes which are felt, and there are some unseen changes. So if we talk of the changes which are seen, you know, the apple is likened to the shape of a man, and the pear is likened to the shape of a woman. Why does it happen? It is because estrogen helps in fat deposition at the bottom, at the behind and the thighs. So you know the shape is like this, and the fat deposition at that area for a woman is good for her cardiac status. That fat is not metabolic fat, so that woman is going to have an advantage with her BP, with her cardiovascular status, with her heart attack, with her strokes, because that fat is a safe fat to happen. So once menopause happens, the fat starts depositing around the abdomen, and the woman who was a pear is slowly becoming an apple. That is one thing. Second thing is the skin. The moisture content, the collagen content slowly starts diminishing. Skin becomes thinner and wrinkles. Hair, there is, you know, a frontal balding of hair which is similar to men. Facial hair, pigmentation, because the skin is very sensitive. The facial skin is very sensitive to estrogens. And what are the changes which are felt? The first thing that is felt is something called as vasomotor disturbance. So what is this vasomotor disturbance? It is a feeling of hot flushes, like she suddenly feels hot, she suddenly feels cold, she's not able to sleep, she gets a lot of night sweats, and it's like the family is wondering what's happening to my mother. It's the AC on and she says she's sweaty, and the moment you switch on the AC, she's all cold. So these are actually changes which are again happening because of estrogen deficiency. The other changes that happen are with the urinary area, like frequently wanting to pass urine, getting up at night several times to pass urine. Why does this happen? The estrogen, which is very much abundant in the areas of the vagina, the urinary tract, that deficiency leads to these kind of problems. And then there are psychological issues, there are sexual issues. What are the sexual issues? There is a decreased interest in having sex. Sex becomes more painful, and the skin around the genital organs, they become weak, and that is the reason why the sex becomes painful. And there is a color changes in the skin. This can lead to very uncomfortable issues later in life, and these need to be addressed. So we find many husbands coming with these complaints, or the women hesitate to normally talk about this, but this really needs attention and this really needs counseling, and there are several treatment modalities for all this. And of course, psychological changes are very important. It's like a woman now comes to know that she has reached a phase of life. She starts feeling that she's old age has set in. There are some women who, you know, they were women, there was a lot of sex appeal at a certain age, and that is gone. So you kind of start feeling that you're less attractive, you're less attractive to the opposite sex. And then there are feelings of depression, there are feelings of anxiety. You know, there are the 7 dwarfs of menopause, they say. Itchy, there is bitchy, then there is sweaty, there is sleepy, there is bloated, there is a psycho, and forgetful. You know, these are the 7 dwarfs of menopause. So there are a lot of changes which are happening, and a woman at this phase is handling this part. She's handling her vasomotor symptoms, she's handling the feeling that she's growing older, and there are changes happening in the family, like the children have grown up and they have left home. It's like an empty nest. Husband has retired, there are financial issues perhaps for some, and especially a woman at home takes care of the elderly people. So she has seen the mother-in-law or the mother going through a lot of health issues, so she gets worried that is she going to face the same. So these are all changes which women have to accept.
So ma'am, as you were just explaining about the changes which are not visible outside, like the diabetes, heart, cancers, and the hypertensive things and all, those are some things which I think many women in their regular day-to-day life also experience, but then these are more evitable once they reach their menopause, is what you meant. So could you please tell us a bit about each one of them so that women do understand that and they take certain precautions so that they don't land up in these troubles in their future?
Actually, these silent changes are the ones which impact their life. And of these, the single most important change would be the bone, because the estrogen keeps the bone strong and supple. And once the estrogens are out, the bone starts losing calcium, the bone starts losing matrix, it becomes thin, 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 and thinner. That is called osteoporosis. Osteoporosis is a silent epidemic because a woman doesn't know that she's losing bone, and that is extremely important. Why we need to screen a woman who has attained the menopause for this problem, because it is preventable, it is treatable, to a large extent it can be modified. The other important thing is the cardiovascular issues. That is, the woman after menopause is very susceptible to hypertensions, to cardiovascular diseases like heart attacks, like strokes. And why is it so? Because estrogen protects the woman from these problems. And once you lose estrogens, a woman is as good as a man in getting a heart attack or a stroke. Then the other silent thing which happens at this stage, it's also related to the age itself, is cancers. Cancers of the breast, cancers of the uterus, endometrium, cancers of the ovary, cancers of the cervix. We need to be alert and we need to take precautions for these. These are the main things which need a woman to come to us for proper screening, for proper guidance, and perhaps for treatment. Of course, even the other issues like the psychological distressing issues, the vasomotor symptoms, they need therapy. If it gets distressing, you need to come to us, because we have an array of treatment which we can offer depending on how severe is the problem.
So ma'am, as these conditions just we were discussing about, I think these can be tackled even at the early ages. The regular health checkups for the women that need to undergo, even the self-examination of breast which needs to be done.
Yeah.
I think we need to reiterate and educate the women of our country a bit more.
Correct.
And ensure that they take their annual health checkups regularly.
Yes.
So that even though they land up in the menopause, they don't land up in these things. And I think preparing our body a bit early for this thing, I think that would help. Does that help a lot?
Very much. Preparing the body, preparing the mind. We need to know that calcium supplementation has to start much earlier, as early as adolescence, because you need to be exposed to sunlight. So calcium from then on builds the bone reserve. Woman starts losing calcium from 30 years. So did you realize that all the age you need to take calcium? Most of you wouldn't even think about it. Even after delivery, you need to take calcium until you're breastfeeding the baby, because the calcium from your bones will just go into the breast milk. And what about your stores? You need to take calcium adequately. You need to have good lifestyle attitudes like exercise, not putting on weight, good health, good dietary measures from early on, because suddenly when you turn 55 and you say that you start doing walking and you start exercise, it is something strange, it is not natural. Many women may not accept it. Then you need to come for annual health checkups. Even if you don't have a complaint, see, we are not treating disease, we are preventing disease. So once therefore there are specific preventive measures for each cancer, like say for breast, we advise self breast examination from the age of 20 years, and we advise clinical breast examination, that is, you come to us once a year and we examine your breast. And then there are sonographies and mammographies which start after 40 years. Then for the ovaries, ultrasound. For the cancer cervix, pap smears. What do you do with bleeding issues? I think we need to discuss a lot about the bleeding problems which happen before menopause, bleeding problems which happen after menopause, because we need to prevent cancers. We need to prevent the bone from becoming weak. We need to take care of your cardiac health. So these are things which can be prevented, and that is when you need to come to us on a regular basis. You need to do your lifestyle measures, and you need to start those measures much younger, because your weight is your priority from young age. Calcium is your priority from young age. These are things which a woman needs to understand.
Yes, ma'am, as you were just mentioning about all these precautions that we need to do and the role of health checkups, you just mentioned about the bleeding problems. I think many women, not just women, even the girls from their early menstrual cycle, they're having a lot of bleeding issues. And as you said just now, there are many bleeding issues during the menopause also.
Yeah.
Could you please explain us a bit?
Since we are focusing on menopause, the bleeding which happens 3 to 4 years before menopause can be distressing. That area is called as perimenopause. And many women say, oh, we are reaching menopause, so this abnormal bleeding doesn't have to, we don't have to go to a doctor for it. But that is very wrong. You need to come and assess, and we will investigate you to find out if there is a problem, something leading to cancer or not. And according to what we find, we will advise you. So if it is not worrisome, maybe some medicines. If it is worrisome, we need to take biopsies and do the needful. After menopause, see, menopause is 1 year of no periods. Only after 1 year of no periods, we call it menopause. Any bleeding during menopause is also worrisome. Like people worry if they have got cancers. Again, some women say, "Koncham, very little, I have bled very little," and they ignore. But that again is not to be done. We have to find out why she has bled, because there cannot be bleeding after menopause. So we need to find out if it is innocent. We do a hysteroscopy. We find out if there is an issue inside the uterus. We find out if there is a precancer or a cancer, and accordingly. We treat her accordingly. So many times the treatment is very simple, but it cannot be ignored. So abnormal bleeding prior to menopause and after menopause should not be ignored.
So ma'am, as you just completed about the bleeding problems and all the other health issues that are concerned to women's health when they enter the menopause. So how do you manage this menopause when women come to you in your OP?
The first thing is psychologically counseling. Accept, adopt and overcome. Don't accept the problems the way they are, but adopt and overcome. So lifestyle measures are very important. Diet, high calcium diet. Try to not increase your calories by reducing the carbohydrates, taking adequate protein. Good exercise. There are so many types of exercise: aerobics, endurance, the balance, the exercise to maintain a good balance. So there are various exercise measures which can be guided. Then of course these are mainly the life change measures are extremely important, and a lot of counseling, not only to women but also to the family members. They need to understand that there are some changes and their mother is not exactly the same as what she was before, and these changes are a temporary change. Like once you kind of accept all this, it becomes a part of life. So a complete family support is very much required. So this is the first part. Then of course when you come to us, you need to come to a doctor for certain tests. What are the tests that we do? We try to find out if there are other issues in the body like diabetes, thyroid, BP, lipid profiles would be done. How is your blood? How is the calcium? How is the vitamin D? How are the vitamin B12s? Any corrections are required? And then of course, depending on the symptoms, how severe are they? We have various therapy options. We have hormonal, we have non-hormonal options, which we need to discuss. It's like a cafeteria, like you can take an instant coffee, you can take a filter coffee. So depending on the requirement, we treat.
And ma'am, many women post their menopause undergo hysterectomy. So what are the conditions or the situations when a hysterectomy is advised to these women?
Yeah, the woman has to understand that hysterectomy is not the end of all her problems, because the women who come to me says, "Anni teeseyandi, take out the uterus, take out the ovaries, because in future I will have a problem." So that is not the right attitude, because an unnecessary removal of the uterus can compromise her hormones. You know, menopause actually deals with the ovary more than the uterus. Ovary is where the hormones are formed, and even if you remove only the uterus and keep the ovaries there, the ovaries fail a little earlier. So you compromise on your hormones, which is not good. For some women, we may have to remove the ovaries at a younger age for some reason, and for these women, it's called a surgical menopause. And we need to treat them because it can be very distressing, suddenly facing all those hormonal lack of hormones. It can be very distressing. Hysterectomy is always the last option. Even after menopause, if there is bleeding, try to find out what is the cause. We have, various options, hysteroscopies, we have Virinas, we have a look inside the uterus, we correct those issues, we check out if there is a cancer. So hysterectomy is always the last option. It should never be the first option, and women must not be so afraid of keeping their uterus and ovaries there. There is no need for that fear.
And ma'am, your final words to women who are going to enter menopause or who are already through menopause.
Menopause is a part of life. It's not a disease. Do good exercise. Let food be your medicine. And please come to us, get your annual checkups done. Don't shy away from that. And be happy always.
Thank you so much, doctor, and thank you to your audience for patiently listening us. I know many women have many more concerns about such problems, and please do watch our space for more such health bulletin and health updates. Thank you. Namaste.